As the US records a record number of new daily cases and hospitalisations, we're looking at the 5 biggest challenges set to face Joe Biden. This is Coronavirus, the latest from the Telegraph. I'm Theodora Louloudis. It was an election under unprecedented circumstances, and it's not even really over. The road to the White House may have been a long one, but the road from this point may well be bumpy. The president-elect has already selected a team to help him along that windy path. On Monday, barely 2 days after winning the election, Mr. Biden unveiled his coronavirus task force. It was a move read by many as a clear sign of his priorities and an effort to distance himself from President Trump. The team of 13 scientists and public health experts have a mammoth task on their hands. Or 5 mammoth tasks, according to my colleague Anne Gulland, deputy editor of the Telegraph's Global Health Security team, who's been writing about the scale of the 5 big challenges set to face Joe Biden and his team. There are, of course, 2 months until Mr. Biden assumes the presidency, but I asked Anne to come on the podcast to lay out the scale of the task he's set to inherit, and she started by filling us in on the current situation in the United States.
Well, the numbers are quite amazing, actually. So for the last few days, there's been record numbers of cases every day. So yesterday in the US, there were 160,000 new cases of coronavirus. I mean, obviously testing has increased, so like it has here and elsewhere, but still that is quite amazing. So there have been 240,000 deaths in the US, more than 10 million cases. And according to Anthony Fauci, one of the President Trump's top advisors, numbers are rising in 40 out of 50 US states. And there were also 60,000 hospitalizations yesterday or the day before. So, we can say that there's increased testing. So that's why there's so many cases, but 60,000 hospitalizations, pretty huge, really.
Yeah, it is. We are talking on Friday morning, so that day being Thursday. And Anne, you've written for The Telegraph about how there are 5 things that are top of Joe Biden's presumably quite long to-do list. Let's break them down. What's number 1?
Number 1, and I think it probably won't come as a surprise, is face masks. And I think during the election campaign, I thought it was quite interesting. So in a speech that he made on Monday, Joe Biden said, it's time to sort of depoliticize face masks and normalize, de-weaponize them.
It doesn't matter your party, your point of view. We could save tens of thousands of lives if everyone would just wear a mask. A mask is not a political statement.
But I think he kind of did politicize them during the election campaign because he kind of made a virtue of wearing them, all the time. And it was a way of making kind of a sort of line in the sand between him and Donald Trump. Donald Trump was very rarely seen wearing a face mask, whereas Joe Biden would often go off, walk to the podium whilst wearing his mask and then take it off as he began to speak. So I think, he did sort of politicize them. But anyway, so he said he wants them to become normalized, like they are becoming here now, and I suppose like they are definitely in Asia. And in his list of priorities, he says he wants to encourage every American to wear a mask. And he also wants governors to make mask wearing mandatory. It was interesting yesterday, I was listening to a talk by Anthony Fauci, who is one of Trump's advisors. And he said that that's been one of the problems in the United States, is this things aren't done in a uniform way because of the state system, and that some states have been quite quick to open up compared to other states. So there's been this very sort of patchwork response. So it'd be interesting to see if Biden will try and get a more uniform response across the states.
Part of the challenge here is going to be implementing a culture change, both in terms of mask wearing and in terms of, it seems, a minority's attitude towards vaccines. There is a sense of vaccine hesitancy in the US, isn't there? And that is, in fact, Biden's big challenge number 2. Anne, on your list, tell us about that.
So obviously the news on Monday about the Pfizer vaccine is really good news. So he says he's going to invest $25 billion in vaccine manufacturing and distribution that will, in quotes, guarantee it gets to every American cost-free. That's obviously a big question in the US, where the costs of healthcare is a real hot button issue. But I think, whether people will actually have the vaccine is another huge question. I mean, I would say it was more than a minority. I think most polls show that around half of people would refuse a COVID vaccine if offered to them. Wow. And I don't think President Trump really helped that, because he was talking about getting this vaccine out before the elections. I don't know if you remember that, which I think, would obviously worry people, if this idea that maybe he's trying to politicize vaccines. So, that is a big problem. And we saw sort of pockets of vaccine skepticism with measles a few years ago. There was parts of New York, and it was very different. I mean, I think there were parts of sort of maybe the more kind of hipster type areas, and that was sort of driven by people wanting to be healthy and so-called healthy, sort of not wanting chemicals in their bodies and that kind of thing.
That 50% figure that polls suggest 50% of Americans could refuse the COVID vaccine is really striking. But there is a reason, isn't there, Anne, why vaccine skepticism is perhaps higher in the US than elsewhere?
Yes, so it's really interesting. So in 1976, US President Gerald Ford was seen to have rushed a rollout of a swine flu vaccine. There was a fear that there was a swine flu pandemic about to sweep the world. The pandemic never came, but the vaccine was rolled out. And 45 million people in the US received the vaccine, and 450 got a neurological condition called Guillain-Barré. I mean, I know it sounds tiny, but, it's significant. So more than 30 people died, and that caused a huge scandal and also led to introductions of really strong safety regulations in terms of trials for vaccines and drug development.
The Lancet Medical Journal estimates that around 60 to 72% of the population would need to be immune to coronavirus, either naturally or through vaccination, in order to achieve herd immunity. Before we reach that point, the message from the WHO is pretty clear: test and trace. And this brings us on to the big challenge number 3 for Mr. Biden, which is implementing a contact tracing system. There is no contact tracing system in the US, is there?
No, well, I mean, it's been a problem in many countries, that this is something that I think has fallen by the wayside. So Mr. Biden, he's said that he's going to employ 100,000 contact tracers. So we'll have to wait and see whether that happens and whether that works. Obviously, that's a very good plan, but the devil is in the detail in all these things. There have been difficulties because of the sheer numbers of people needing to be traced. So if you've got 160,000 new infections a day, that's pretty mammoth task. There's also been delays with test results, and also just a huge spread of the disease in the community.
It's always going to be a big task in a country of 320 million people. But even if you don't get to the tracing, you really need to be doing the testing. What's the state of testing in the United States at the moment?
Well, they're a bit like us, I think, as well. So they've increased testing. There was some problems right at the beginning of the pandemic when some dodgy tests that didn't work properly were sent out. But that's been resolved now. But it's still not perfect. So I think one measure of whether enough tests are being carried out is to look at the proportion that come back with a positive result. So if you're getting all your cases, only a small proportion should be positive. The WHO says, the World Health Organization says that less than 10% of tests should come back positive, but ideally it should be less than 3%. So in the US, around 8% of tests are positive, and that's about the same as the UK. So Mr. Biden has promised to increase the number of drive-through testing sites, which I suppose a drive-through is a very American solution, and also invest in new kinds of tests. So we'll have to see.
Yeah, we heard Donald Trump saying on several occasions that, of course, if you do more tests, you're going to have more cases.
Well, I think Donald Trump said they were doing too much testing, didn't he? There was said we need to slow down the
testing, exactly. Speaking of misinformation, that is, in fact, big challenge number 4 on your list, which is combating misinformation and listening to science. Donald Trump mocked Joe Biden at a rally in October for saying that Joe Biden would listen to the science.
I just think, not having Donald Trump there is going to be a huge boon for combating misinformation. So, Donald Trump was touting things like
hydroxychloroquine. A couple of weeks ago, I started taking it.
Wondering whether people should be injected with disinfectant,
where it knocks it out in a minute, 1 minute, And is there a way we can do
was
something
openly
like that?
criticising his advisors. So I'm assuming Joe Biden won't be doing things like that.
It's hard to talk about coronavirus without people referring to the pandemic as an unprecedented event. Pandemics like this are, of course, not totally unprecedented, and governments do have, or should have, a plan for pandemic preparedness. And boosting that plan is the fifth and the final challenge on your list.
Yes. I mean, the US always used to be known as its sort of the kind of exemplar for its kind of military-style readiness to tackle disease outbreaks. And so it is, I mean, this is quite a surprise how badly the US was prepared for it. But there's been a lot of cuts to key American institutions. So, for example, the Centers for Disease Control, which has really been sidelined during this pandemic. Normally, they're the sort of equivalent of the Public Health England in the UK. So, in England, but so they have really been sidelined. I mean, they are huge. I mean, they've got so many experts in so many different infectious diseases, and there were quite a lot of cuts to the CDC prior to the pandemic and other sort of pandemic preparedness planning bodies. So
all under President Trump.
Yes. So Mr. Biden, so he's pledged to reinstate this is quite a mouthful, the White House National Security Council Directorate for Global Health Security and Biodefense. So that was established by President Obama, and that was all about, global health security and tracking pathogens and things like that. So, I mean, obviously, Joe Biden is going to reinstate something that he set up or he had a hand in setting up. So maybe that's not a surprise. And there was also this program called Predict that was run by an organization called the EcoHealth Alliance. And they would be the people that actually go into the field. So they're like the proper virus hunters. So we did a great feature on them a few years ago. And they go to places like Sierra Leone or China or Vietnam. And they go into these like bat caves. And they go and, because bats are their reservoir for these huge outbreaks, and they go and take samples and test them and have a look at them. And that program was all about predicting, hence the name Predict, the next pandemic, and funding was cut. So, Biden says he will reinstate that funding. So that's pretty good. And he has also said he would reopen the CDC office in Beijing. So again, that sends out a message.
What's your impression, Anne, of which is Joe Biden's biggest challenge that we've discussed?
I think the biggest challenge will be the misinformation and the vaccine skepticism, which kind of, they all roll into one, really. So speaking to social media, I think it's Twitter and Facebook, and Google have pledged to combat misinformation, but, it's very hard to fight. So I think personally, that will be the massive one. And if, like you say, if only 50% of people get a vaccine, then we know it's not going to stop. So we'll have to see what happens.
The rest of the coronavirus latest news. The UK's R number has dropped to between 1 and 1.2, according to government scientists. The Scientific Advisory Group for Emergencies, also known as SAGE, said the reproduction rate of the virus continues to fall, but it warned that deaths and pressure on the NHS will continue unless the R rate drops below 1 for an extended period of time. A number of 1 or above means the epidemic continues to grow. But on Thursday, the government announced a record high of over 33,000 new daily confirmed cases in the UK. You can check whether cases are rising or falling in your area by using our interactive tracker. I'll put the link to that in the episode description. A drug used for multiple sclerosis was shown to nearly halve the chances of developing severe coronavirus symptoms in hospitalised patients and may prevent deaths. A new trial in over 100 COVID patients at 9 UK hospitals suggests an inhaled version of the treatment interferon beta-1a meant patients were twice as likely to recover within 2 weeks as those given a placebo, even if they were sicker to begin with. Those behind the research published in the Lancet Respiratory Medicine journal are now calling for larger trials. You can read more about that trial by reading our health editor Laura Donnelly's full write-up of the research. You'll find the link to that in the episode description. And if you don't already subscribe to The Telegraph, you'll want to head first to telegraph.co.uk/audio, where you can sign up to 30 days free. If you have a question about the virus that you'd like an expert to answer on the show, email me at coronaviruspodcast@telegraph.co.uk. If you send me the question as a voice note recorded on your mobile phone, you might even hear yourself asking it. And finally, if you found this podcast helpful, please share it with a friend or on social media. This is Coronavirus, the latest from The Telegraph. I'm Theodora Louloudis.